All right, have you heard of Havana syndrome? We told you about this earlier in the week. It's something like out of a spy movie. Dating back to 2016, U.S. spies, diplomats, and troops in Cuba have been complaining about vertigo and extreme headaches. The illness has been dubbed Havana syndrome. The U.S. is reportedly studying how this happens, and some people believe it was an acoustic attack caused by small devices that send out radio waves.
So our medical expert, Dr. Kohli, here with us to break down not so much the story itself, but this syndrome, Havana syndrome. If you've never heard of it before, Dr. Kohli is going to explain what it is exactly.
Yeah, so it's just like Corey said. Around 2015, 2016, we started noticing that diplomats, CIA officers, ambassadors, people traveling abroad, not just in Havana, but actually in other countries as well, Vietnam, even Washington, D.C., started having these weird constellation of neurological symptoms where suddenly they would hear this tinnitus or ringing in their ears, and they described it as a marble being dropped on a metal plate. Oh, wow. Kind of the sound that makes. Vertigo and imbalance, problems with dizziness, fatigue, brain fog. And initially the theory was that perhaps these are targeted acoustic attacks that these diplomats are being targeted for. Since then, we've sort of moved away from that theory, but it's certainly a very interesting syndrome that does happen to people in these types of situations.
It's so weird because we talked about this the other day, and they're saying like it could be this device that's as small as a backpack. Can that really happen? Can something like that actually cause those things in people?
So in theory, yes, but we do not believe that Havana syndrome is actually caused by that. And the reason is because it doesn't follow geographical clustering. So imagine if I brought a backpack device that was giving out acoustic waves, let's say, both you and Drew would be having those symptoms, right? But we don't see it in the family members. We don't see it clustering geographically. We just see it in the diplomats who are in those high-risk situations. So really what we think is that it's a combination of the context, which is this extremely high stressful job where you're constantly under surveillance and you're constantly looking for external threats, combined with the fact that you have this neurological predisposition, because the factors that track most well with it are people who have migraines, people who have anxiety, people who've had any kind of vestibular issues or vertigo, and people who have chronic fatigue and those types of things. So it's really the combination of the biology combined with the job, and it begs the question of whether in these types of high stressful jobs, you know, we should really be screening people who are at higher predisposition to sort of prevent it. And interestingly enough, media exposure seems to trigger it as well. So people who are on the air more often have to perform. They seem to have higher incidence of these symptoms too.
So it gets its name, Havana syndrome, from the situation in Cuba, which you described right here at the beginning. But if someone was to come in with these types of symptoms, is it ever described as something else? Is there another name for this, I guess is what I'm asking?
Well, so the first thing we do, Drew, is to rule out other causes because other things are more common. So vestibular migraines, for example, migraines are extremely common, and a vestibular migraine looks very similar to this because it's your balance system and your ears and your hearing kind of playing tricks on you, as well as the pressure in the head. We rule out stroke, we rule out tumors in the brain, we rule out TIA, all of those types of things. So assuming it's none of those other things, it's rare for us to call it in the clinic a Havana syndrome because that's very specific to that type of profession and those types of officers. But it's something that's getting increased recognition. There's 1,500 identifiable cases now and more emerging as well. And we just want to be clear that we're not discounting the syndrome, we're just discounting the fact that this is an acoustic attack. Because again, it's not following scientifically a pattern where why should it only affect one person and not the person sitting next to them?
Real quick, are there treatments for this? And if you tell me more sleep, I'm going to be very sad. Are you going to say more sleep?
No, okay, it's something called vestibular rehabilitation. Okay. And that's a really effective treatment. That's a nice thing. This is not a neurological illness. This is not degenerative. It's not like Alzheimer's or Parkinson's. It's not going to keep getting worse. In fact, for most people, if they do this vestibular rehab, they do a little bit of meditation, chronic stress therapy. Sometimes we treat the headaches like we do with migraines. They can actually go back to work and be fully functional as diplomats in their high stress professions, be on the air and what have you. But it is really important for us to start recognizing, even in ourselves, if we have these constellation of symptoms, neurological predispositions can set it off, and sometimes stress can just be that trigger that pushes you over the edge.
Dr. Kohli, always a great source of knowledge. Thank you for being with us here this morning.